Hello and welcome to Module 2 of this three-part series on language sampling. In this module, we're going to focus on various analyses that you can do with conversation language samples. My name is Geraldine Timler, and I'm an associate professor from James Madison University, and I will be your host as we walk through these three modules. If you haven't looked at Module 1 and completed the knowledge check, I recommend that you go and do that one first before continuing to review this module. Recall that I'm receiving a salary from JMU and I was compensated for development of these modules from the Virginia Department of Education. I have nothing non-financial to disclose. Let's briefly look at your learner outcomes for all three modules. In number 1, you learned about optimal language sampling contexts for various ages and best practices for a collection of conversation samples. In this module, which may be a review of things that you learned in grad school, you're going to learn about all the different ways we can analyze conversational language samples. And finally, the third module focuses on pragmatic language skills. Here's our agenda for Module 2. We'll talk about strategic tips for identifying analyses that may be needed after you collect a conversation sample. We'll do an overview of analysis procedures and possible intervention goals for syntax, morphology, semantics, and pragmatics. And finally, I'll provide some resources for further information. So let's start with which analyses should I do? 3 selection tips. Tip 1, consider the purpose of your assessment. If it's to determine eligibility for services and to document the student's baseline of communication skills, you need to do a comprehensive set of analyses on the language sample. If it's to plan intervention, when you listen to the language sample, you're going to be looking for error patterns, and these error patterns may or may not have been observed on a norm reference test, and that will then help you to decide which analyses that you should do. If it's for progress monitoring, you already know what you've been working on with the student, so you're going to pick an analysis that aligns with the treatment goals of that student. Tip 2 is to collect parent and teacher information, and I think use of parent and teacher reports is somewhat underutilized in our profession. If you collect parents and teacher information, it'll give you an informed hypothesis about what they're most concerned about, because a parent and teacher has ready access to the student's everyday use of syntactic, morphological, semantic, and pragmatic language skills. Here are some examples of some norm-referenced or criterion-referenced parent and teacher report measures. For preschoolers, there's the language use inventory from ages 18 to 47 months. For students between the ages of 4 years to 16 years, there's the Children's Communication Checklist, or the CCC2. We'll be focusing on this one in just a bit. And then, of course, many of our omnibus measures have parent report measures now. For example, there's the Self-5 Pragmatics Profile, which is for ages 5 to 21 years and can be completed by the parent, teacher, or even the student. Some clinician and teacher report measures include the Self-5 Metalinguistics Profile, and the Metalinguistics test is separate from the Self-5 battery. And this metalinguistic profile can be completed by the clinician for students between the ages of 9 to 21 years. And then there's the Pragmatic Language Skills Inventory for teachers to complete of students ages 5 to 12 years. I wanted to give you more details about the CCC2 because it covers such a broad range of the school age years from 4 to 16-11, and also it has items for multiple areas of communication skills. And by the way, this is not just a parent measure. If a teacher has known a student for a minimum of 6 months, the teacher can also complete this measure. It consists of 70 items divided into 10 scales, and we'll look at the scales now, and for each scale I have an abbreviated example of an item that the parent or teacher might rate for that scale. Speech leaves off the beginnings or endings of words, so this is clearly to identify students who might have a speech sound disorder. Syntax leaves out is. Semantics forgets words he or she knows. And coherence confuses the sequence of events when trying to tell a story. We'll be looking more closely at cohesion or analysis in a little while. Other scales on the CCC2 include initiation. It's difficult to stop him or her from talking. Scripted language provides over-precise information in his or her talk. Context misses the points of jokes and puns. Nonverbal communication does not look at the person he or she is talking to. Social relations appears anxious in the company of other children. And interest shows interest in things or activities that most people would find unusual. These latter two scales, social relations and interests, were developed primarily to identify children who may be at risk for the diagnosis of autism spectrum disorder. Here is the results from parents who completed the CCC2 on their 7-year-old. After the parent completes the rating scale, the clinician enters all of the ratings into an Excel file that is included with the CD scoring RUM for the CCC2. And then the scoring RUM provides this table as its output. Let's look at some of the scores more closely here. The main score of interest is the General Communication Composite Score, or the GCC. When you look inside the examiner's manual, you'll find that the best combination of sensitivity and specificity for identification of a language impairment is a GCC score of 85 or lower. This student has a score of 76, so this clearly suggests a communication impairment. Now, the scaled scores will give you information about which area the parents have most concerns about. The scaled scores here are based on a mean of 10 plus or minus 3, meaning that scores of 7 or higher indicate performance generally within normal limits. So we can look at this broadly and say this child probably doesn't have a speech sound disorder or a syntactic disorder, but we do have concerns in coherence and initiation. When I see a score like this in coherence, I know that I should collect a narrative sample, because in narrative discourse, you have to connect your utterances, and so you have to use pronouns correctly. And so this is an indicator that I want to collect that kind of sample. I also note that there's some problems here in nonverbal communication. This could be reading nonverbal cues or displaying of nonverbal cues. So altogether, this particular profile suggests that I want to do a pragmatic analysis of several language samples. My third and final tip is to just listen to the sample or look at the sample after you have collected it. And what you see here is a cover sheet that is the first page of a share and tell rating scale, which we're going to be looking at in the next module. But I developed this cover sheet so that SLPs could make notes about errors, which would guide them in thinking about which analyses they want to do. So for example, in syntax, you might note if there are few or no complex sentences and limited use of subordinating conjunctions. In fact, here you could note which subordinating conjunctions you did here. In morphology, you're going to notice or document verb tense errors and any other kind of morphological errors. In semantic and word use, you might have some general concerns about vocabulary, or specifically you might note frequent use of fillers such as or pauses, or frequent use of nonspecific words such as thing or that, which could indicate some word access problems. In pragmatics, you might note turn-taking concerns or unclear or confusing utterances, which could indicate a cohesion problem, something we'll also be talking about later in this module. We won't be talking about speech intelligibility or sound error analysis, but obviously language samples provide a lot of information about speech sound disorders, so here you could note intelligibility concerns and even write specific substitutions, distortion, or omission errors. And finally, in the area of fluency, you might note frequent repetitions and revisions, which are referred to as speech disruptions or mazes, and actually fillers and and pauses are also mazes. If you notice those, you might want to do a speech disruption analysis, which we'll be covering. One thing we're not going to cover in this module is disfluencies or stuttering, and those differ from mazes because there might be some prolongations or frequent repetitions of single sounds or syllables accompanied by some facial tension. So we won't be talking about that, but certainly you can use a language sample to note any concerns you might have about a possible stuttering disorder. Let's start our review of various language sample analysis procedures, and we're going to focus on conversation samples. We'll start with general procedures, so how we begin the analyses, and then we'll talk more specifically about analyses for syntax, morphology, semantics, and pragmatics. General procedures. Collect at least 50 student utterances. There are some labs around the country looking to see if shorter samples could give the same information, but right now the best evidence converges on it collecting at least 50 utterances from students. For syntax, morphology, and semantic analyses, you need to transcribe the language sample, but you may only need to transcribe the student utterances. Another shortcut is to consider using speech-to-text software instead of typing it yourself, so you would repeat the student utterances with clear articulation. For pragmatic analysis, you do need to transcribe the clinician utterances for certain analyses. There are other ways, though, to look at pragmatics which don't involve transcription at all, and we'll be looking at those methods in the next module. In any case, I recommend that you keep the recording of all language samples in case you need to review pragmatic language skills at a later date. The other general procedure to think about is that you want to focus on which normative database you're going to be comparing your students' results to. So we have two very popular databases now in Virginia. There is SALT, the Systematic Analysis of Language Transcripts, and of course there's also SUGAR, Sampling Utterances and Grammatical Analysis Revised by Pavelko and Owens. These are great databases, but they do have different transcription, utterance segmentation, and morpheme segmentation rules. Let's look at some of the differences between SALT and SUGAR. One of the biggest differences is how morphemes are counted. So here you see a list of words in SALT and SUGAR. Gonna is actually one morpheme in SALT, but in SUGAR you type gonna as going to and then count it as 3 morphemes. Dislike and foolish are both one morpheme in SALT, but they are actually 2 in SUGAR. Jumped is 2 morphemes in both SALT and SUGAR, but the way that you separate that morpheme is different. There's a slash between the P and the ED, and in SUGAR, of course, you're just leaving a space. The major difference between SALT and SUGAR is that SUGAR conventions do give credit for students' development of derivational morphology, probably one of the reasons why MLU SUGAR sees changes all the way up through age of 10 in school-age students. There are also some differences in how utterances are segmented between SALT and SUGAR. So let's look at the student utterance, I like juice and I like pop and I like coffee. In SALT, this would be 3 separate utterances. So these are 3 independent clauses, and you'll note below that SALT includes the and to connect these clauses. So SALT would say, divide this up, I like juice, period, and I like pop, period, and I like coffee, period. In SUGAR, though, the rules are that you don't divide the first 2 independent clauses that are connected by and you also don't use punctuation in SUGAR. So SUGAR would divide this one utterance into 1, I like juice and I like pop, 2, I like coffee. So again, it's just a reminder that if you're going to use a particular normative database to compare your student to, that you need to follow the transcription and morpheme segmentation conventions for that particular database. Let's focus on specific kinds of analyses now. For each analysis, I'm going to provide some general intervention goals. So our first analysis is syntactic complexity. And of course, syntactic complexity measures focus on the identification of complex sentences. In SALT, this measure is referred to as the subordination index, and it's reflecting clauses per communication unit, or C unit, and a C unit is defined as one main clause and attached subordinate clauses. In Sugar, the syntactic complexity measure is clauses per sentence, and again there's slightly different rules for how clauses are counted. So you want to look at the SALT and Sugar rules when you're doing syntactic complexity. Possible intervention goals, and these are goals, not objectives, would be to increase the number of complex sentences that a student is doing. And remember, from Module 1, we're more likely to see complex syntax in narrative, expository, and persuasive discourse. So if you're working on increasing complex syntax, you probably want to do it through narrative intervention or expository intervention. The other thing that you might be working on in this area is increasing diversity of complex sentences. So if you have a student who connects everything with but or an and, you might want to be working at helping the student to use subordinating conjunctions such as although and while. Now, if you're like me, you might need some review of your grammar. So there's a couple of resources for you. You can go to the Sugar modules on the Virginia Department of Education website, where Stacy Pavelko does a really nice job of reviewing complex syntax. You can also look at the Khan Academy videos in YouTube, and here are 4 that I recommend: dependent and independent clauses, subordinating conjunctions, clauses, and types of clauses. You might even share these Khan videos with older students, like adolescents and middle school and high school students that you're working with. Our next area of analysis is in morphology, and probably one of the most widely known metrics of morphology is the MLUM, or mean length of utterance per morpheme. Reduced MLUM is a very robust clinical marker of language impairment in preschoolers who use Standard American English, or SAE. If you find that a student's MLUM is reduced for age, then you want to look more closely at each utterance to identify morphological errors, and you might see more of these errors in verb phrases, as verb phrase errors is also another clinical marker of language impairment in students who use SAE. You'll also find more of these errors in complex sentences, because these sentences take a bit more resource allocation for the student to formulate. One consideration here, though, is if you are assessing a student who's from a culturally and linguistically diverse background, you need to remember that the morphological and syntactic rules in various English dialects, and of course in other languages, differ, and so you can't use the norms to identify impairment in a child who is CLD. For this child, you want to review the material on the Leaders Project site about dynamic assessment, and also the ASHA practice portal on spoken language disorders. Intervention goals for morphology include increasing the length of noun and verb phrases and increasing production of specific morphemes. And typically these morphemes are going to focus on verb phrases such as the past tense. If you did a Sugar analysis to determine the student's MLUM, then you can follow up with a Sugar sub-analysis. Directions for a Sugar sub-analysis can be found in a Sugar module on the Virginia Department of Ed website. Let's turn now to semantic analyses and goals. Normative data is available for the number of total words in a sample, referred to as NTW in SALT, and the total number of words, referred to as TNW in Sugar. Another measure provided by SALT is the number of different words, or NDW, which reflects vocabulary diversity. One caution here, though, is that this number is highly dependent on the number of topics discussed in the sample. Fewer topics, lower NDW scores. So most experts suggest that clinicians should rely on the number of words in a sample when identifying a semantic impairment. Another important consideration is the student's socioeconomic status level. Students from impoverished background have less access to vocabulary words. So if you have a student from a low SES background, you want to make sure that the normative database you're comparing that student to also has students from a similar SES background. If not, you want to go back to the Leaders Project website and review the dynamic assessment material. One other way to document semantic deficits that's gotten recent attention in the literature is to count or describe the number of lexical errors, which is really just incorrect word use. For example, I had a student in my lab who recently referred to himself as the medium child when he really meant that he was the middle child. You can also look at the number of non-specific words such as thing, stuff, this, and it. We all use some of those words sometimes, but if you see a frequent use of these words, this suggests a vocabulary access or retrieval problem. Goals for vocabulary focus on increasing use of curriculum-based vocabulary in the student's classroom and in the language samples, and then also seeing a subsequent decrease use of non-specific words. Another analysis you might consider completing is a speech disruption or maze analysis. Here are some examples of speech disruptions or mazes. Repetitions, revisions, silent pauses of 2 seconds or more, and filled pauses. In the examples below, these utterances are transcribed in SALT. The words in parentheses are not counted when you calculate MLU in the SALT program. They're in parentheses to show that they were mazes. So let's look at the first one. I didn't know that. That's an example of a repetition. If we only ran faster, we, she could have caught him. Or catched him. That's an example of a revision. The revision is from we to she, although there's also some repetitions there. And you note that the student said catched instead of caught. The third example, we couldn't go because the car, my mom forgot the gas, shows a 4-second silent pause, a filled pause with 2 ums, and another revision. The student revises the car into my mom forgot the gas. Now, if you notice a number of speech disruptions as you're listening to the sample, I would suggest that you transcribe them. Just remember that in Sugar you don't transcribe these mazes at all, and actually you don't need to transcribe them in SALT either. But I recommend that if you are concerned with how many mazes you heard when you were listening to the sample, that you do transcribe them. And that's because they can indicate some word access or retrieval difficulties or formulation difficulties. If you have concerns about the number of speech disruptions or mazes that you heard in a student's sample, here is an analysis that you can do to determine if it's a problem area for the student. Paul, Norbury, and Goss in a child language textbook suggests that if a student has more than 7 to 8 mazes per 100 words, that indicates significantly tangled speech. So here are the directions to get to that criterion referenced cut. First, you're going to count the number of words and pauses in mazes and the number of unmazed words. And just remember that mazes include both filled and unfilled pauses, repetitions, and revisions. And then you're going to divide the number of mazed words and pauses, that total number, by the number of unmazed words and multiply by 100. This gives you the percent occurrence of mazes per 100 unmazed words. And again, if you get a calculation that's more than 7 to 8 mazes, then you might be concerned about this student's skills. So let's look at some speech disruption or maze intervention goals. Well, they differ depending upon what types of mazes that you're seeing. For filled and unfilled pauses, this is suggestive of non-specific word use and possibly word access or retrieval difficulties. So you want to work on your semantic goals here of increasing use of curriculum-based academic and social vocabulary. You might also need to teach the student compensatory strategies. So when the student has difficulty with word retrieval, strategies to give his listener some cues or a description of a vocabulary word that he's trying to access instead of using it, thing, or stuff. If you have a student who uses lots of repetitions and revisions, this suggests that there may be trouble with formulation, and you're likely to see more of these in complex sentences, so you may want to do a syntactic goal of increasing production of complex sentences, and the best way to do that might be through narrative and expository discourse, and you may want to use some visual supports to support that student's formulation skills. Let's look very briefly at pragmatic analyses, although we'll be covering this much more in depth in the next module. One of the things you can do is to count the number of times the student is unresponsive to one of your comments or questions, or when the student is non-contingent. And just like for us, when we want to give the student contingent comments and questions about what they say, we also expect the student to be contingent with what we say. So if we notice the student is non-contingent, you want to count the number of times that happens. You can either do that from the transcription or you can count that while listening. Another area we want to look at is the types of speech acts that the student produces, comments versus questions. We'll talk about that more in the next module. You don't always need to transcribe when you're mostly concerned about pragmatics, because there are many rating scales that we'll talk about in the next module that you complete simply while listening and looking at the sample. And when it is pragmatic concern, you want to be sure to rate both verbal and nonverbal behaviors, including eye contact, facial expression, gestures, and body posture. So really for pragmatics, you do need a video recording of the student. A final kind of pragmatic analysis is a focus on cohesion. And similar to mazes, cohesion really cuts across pragmatics, semantics, and syntax. But cohesion is defined as ties across utterances, and we can usually view cohesion errors through unclear or confusing use of pronouns and articles, and you might see more of these errors in narrative, expository, and persuasive samples, because in these kinds of samples, students have to take multiple turns in a row to complete the sample. So let's look at an example here. Once two boys, Bill and Ryan, were running away. Then he fell down and he just kept running away. So he got there first. Well, this use of the pronoun he is confusing because there are two boys in the story. So we don't know which boy the student is talking about. Is it Bill or is it Ryan? So you do want to collect a narrative sample that has characters of the same sex so that you can look at how well the student manages or mismanages pronouns. Here are just a few examples of intervention goals for pragmatics. You can work on increasing the number of consecutive turns in conversation, producing 3 on-topic questions or comments, using eye contact to monitor listener interest. And obviously there's so many more areas of pragmatics that can be targeted. Let's close out this module with a summary, and then in the next slide I'll provide some resources. You always want to go back to your purpose of assessment when determining how many and which analyses to do. If your purpose is to identify an impairment and to determine if a school-age student is eligible for school-based services, while also establishing a baseline of the student's communication skills, you want to complete a comprehensive set of analyses, including syntactic, morphological, and semantic analyses. Fortunately, both SALT and Sugar provide metrics for these 3 analyses. For some students, you'll want to do an additional pragmatic analysis if this is a concern expressed by the parent and/or teacher. If your purpose is intervention planning, then you want to do some additional analyses that you would decide to do after listening to the sample. In this module, we talked about cohesion analysis and speech disruption or maze analysis. Here are some resources for further information about language sampling and analysis. Both SALT and Sugar have information about how to collect samples and norms for various ages. TalkBank has CLAN, another language transcription and analysis method that we did not talk about in this module. Virginia Department of Ed website has further information about Sugar and of course other professional development opportunities for SLPs. If you are a clinician who works primarily with adolescents, you may find Marilyn Napold's book, Language Sampling with Adolescents, Implications for Intervention, helpful both in assessment and intervention work. And finally, in the next module, I will be discussing the Share and Tell collection protocol for pragmatics and also the Share and Tell rating scale. So this completes Module 2. Please go back to the Virginia Department of Ed website and take the knowledge check, and then continue to view Module 3, Pragmatic Language Sampling and Analyses.